Hi everyone, Dr. Brian Steiner here at Woken Spinal Care in Mount Pleasant, PA. This week we're going to talk about the difference between ice application and heat application. This is a very heated topic, not only between doctors, but it's a very heated topic between chiropractors, because some recommend that you do ice and no heat, and some recommend that you do heat and no ice. Today we're going to discuss what each application is and when to apply what. So first let's talk about ice. What is ice used for? Here's how the anatomy works, and I'll explain what heat is too. It's going to be the exact opposite of ice. What's happening when you apply ice is it constricts blood vessels, which prevents blood flow from coming in, which will focus directly on inflammation. So therefore, in a heat situation, heat opens up blood vessels, which this is called vasodilation. What happens is it rushes more blood flow into the area. Now here's the downfall when there's more blood flow into the area. It creates more inflammation. So how do we distinguish when to use ice and when to use heat? So ice. Last week's video we talked a lot about acute phases, chronic phases. That's when you want to use ice, is in an acute phase, when there's inflammation rushing into the area. And there's a bunch of different conditions that you want to put ice on. Bruises, falls, sprains, strains. Anytime there's redness or swelling, those are all very good indications of ice application. Again, when there's inflammation or there's some sort of inflammatory response, that is ice. So what does that mean for heat? Heat is more in a condition of chronic situations. Someone who's been in pain for a long time, someone who has arthritis, osteoarthritis, tension headaches. Another popular one with heat is muscle spasms. They help relax the muscles there. But you also need to realize if there's inflammation or a lot of inflammation coming in, that's when you want to apply ice. And sometimes using a combination of ice and heat is necessary. So you have to be able to distinguish which one is which. Now, how do you apply it? This is a very, very important note that you want to notice in this video here. You don't want to put an ice pack on for 2 hours. You don't want to put a heat pack on for 2 hours. Here's a very, very quick synopsis of how you apply these, whether it's ice or whether it's heat. It's the same thing. When you apply either one, you want to do 20 minutes on, 40 minutes off, and use that diligently. Don't say, I'm going to put it on for 40 minutes and see what happens. The longer you apply something than it's necessary, your body starts to create that as a negative response because it's not used to having ice or heat on the body. So make sure you only do it in a 20-minute on, 40-minute off regimen. Obviously, other common things that you want to be cautious of, don't do it while you're sleepy. And if you do it while you're sleepy, put a timer on there. Put some layers of towels over there so you're not getting any frostbite or any burn or anything like that. So those are just a couple different things that you want to know. Now, what do we recommend? In 95% of cases that come into this office, everybody has inflammation. So we're going to recommend ice. Whenever we do a spinal manipulation, it creates a cytokine response, which is what we talked about last week. This creates an inflammatory response. So you want to put ice on. Very, very rarely do I ever recommend heat to someone right away, or if at all, because people that come into this office obviously have inflammation. Now, if someone's been in pain for 10, 20 years with severe arthritis or muscle spasms, tension headaches, yeah, I'm going to recommend heat. If someone comes in here with a migraine, though, 10 years of migraines, I'm going to tell them ice. So there's different things that I have to take and measures to determine, do I want this patient to use ice? Do I want them to use heat? Do I want them to use both? Sometimes I recommend both. It just depends on how that body is kind of responding. Are they in that subacute phase where they're acute and somewhat chronic? Yeah. So I don't have a problem recommending heat, but in 95% of cases, I do recommend ice. So what is BioFreeze, as a lot of people ask? BioFreeze is not an ice pack. It's not a gel pack. It comes in two forms. It's either a roll-on or a gel. It's a supplement when you're not around, when you're walking around outside, you can't put an ice pack on. That's a good supplement. Do I want you to rely on it? No. But it's always a good thing if you're up and moving around. There is no difference between a roll-on or a gel. It's just a patient preference at that point. We do sell that here in the office, and we do sell ice packs here at the office too. They're the gel packs where you can put them in the microwave for heat, you can put them in the freezer for ice. So they have our logo on, they have our name. Very cool gel packs, nothing crazy. But if you ever need an ice pack or a heat pack, let us know. We can get you one. But other than that, that's all I have for you guys this week. It's a very quick thing, but it's a very important thing to distinguish the difference when to use ice and when to use heat. Next week is Memorial Day. I will post a blog, and I will do a video next week, so look out for next week's blog. Otherwise, everybody have a great week. It's supposed to be nice, and have a good Memorial Day holiday.